About only dear no dear, and yet is no year, and yet didn't say Penini dear, Penini dear no more they say, Kitwane dear.
Cerebral palsy on Kasa on 90 years.
Papa dear, Nina and the woman by one no, watch him into the or your papa and run on with your mountain.
The man Kasani in the bush of say, or you should buy to me Kojano. And I miss so mean to me saying, and yes, I did.
Who have it, sir? Let me see if you are employed. That's what for here.
Between 1990 and 2016, there was 54.8% increase of children living with disabilities, according to the Ghana Center for Learning and Childhood Development. In Ghana, it is believed that children born with disabilities become the sole responsibility of mothers. Fathers, in most cases, abandon the child, leaving the child's upkeep, health, and educational needs on mothers. 5 Ghanaian women with children with disabilities have shared their struggles with Disability News Africa.
From Matadinfi, it's Castle of Anko. I may be near Manamisi. Did you mammy? But you were 6 years. Me won't dear, no, you're normal. But when you have 9 months, 10 months, and I must say, it's such a big. Now, send at the TV and ask some. We turn more the Medico Colebu. Now, Colebu for some who are a hand. To be Befina, Obia sending you if you do not, but I'm sure I sang it now. The child. Afena, a yes, a castle. It's come for Caco. And I console, I must be finding fishing so, and you're free, sir. Tenuntina, man for Uncle Baby. Miss Shessana, a fietino. Timmy Jume Chicacra, and Tiomocano, ma Antoine Manco. A Jumas, my mania in Tina, the Juma, but from to be in your gin. Nino Moku Square, Nakamini. If you are me locking what then, as I could see. If you say 8 o'clock, maybe now Bob say 12 to 1. As some money we every day. It is I know. Ninety a man to an amount coffee should be say, me pemwa, so many you may be cry. Me, I made many to say, you may come and make it Colawi. Inti Sanka fish on baby, I call a mammy no more program in an baby, but some money to sanity. Tea and tears I know. My name Brisse, my coffee shoe, coming yam moi. I met my year Jumadia Shabufana. Now, and no number. Bemani Bush, I will say, or you ensure back. San or medium, mammy, papa. Me knew Pia, me knew Bush, my bush and coming up for me. Bemananka San in the bush, I will say, or you ensure by Timiko Janokan. And I miss so mean to me saying, yes, I did. Cerebral palsy on Kasa on 90 years. I'm a woman. No, or you are in to me in the hospital. But one country, no more family. But Mentinang, the children are realized before Benyabe 2 years. None in one of it. And I'm in Bana, Timbati. Be afraid and say, I am the Nico way. Nurses for no, and say, until more invited me at my own meeting. I far home until I am a coin and send a go home say, I really want my AC. Yeah, mammy, Nico hospital. Yeah, or I say, I am in the Nico hospital. It become meeting now, make and you say, no, yeah, require or more exercise. I said, on to me, she said, I'm messy and then never chance. This is that new woman. Maybe I'm a quit, she say, I'm a
Emiyodu and on 19 so on Casabiano continent canton say biasi. The other time Biana was a woman chair, measure say Biabian. You should be on time, everybody. I had that hand 6 years and only Diana. First, and he say no, I start here. A bayano. True, Sabia no pain and start here. Bayan is the following day. And she first listened, you need to go to a hospital. You say, oh, 9 years. If we are metal pumpers, the carriage me be the woman or drink of Manama Thomas and a baby that. This is a banner between my boy and I said, really no my year. Said you may be seen over Pedia my inside a now I am in the little way. We catch on the supper. I am almost said to see. Yeah, I feel good, baby. Now, I'm ran one day. When you are 4 months, they look almost said to see. I make a kennel. Oh, man, count on sharing. I'm almost said, the idea is fine. Now, way you know, so, oh, say, Apolana Yarea, or moving no. By way of moving and BBI fine. We need to need BBI okay. For to be a sounds so we know 1.5 minutes. So, we have a sir. Let me see, be a man poison. Sounds so waffle be a Scott, I am too much over dear. May be sweet yard and neck. Nasi dog, and you know, you saw that woman and more flannel doctor to be sure. Okay. It's no money, dear, may banny hand 1 year and a man. But now, if you need to me, I'm a banny in this car. Or for J or more nimble for the choir consortium, and I'm listen to my Yaka. And all bomb the same account of the Beji Halloween, young man. It's a phone, and if you run a buy, no, send me to me. Now, my partner, I was having my dear into Nabanasa. Timid one more children, then the children they are. I know what's all boy. The children or buy, no, yes, he said, my son, and for only from Mudia, me 3 years. It was the 3 years in the channel. One Jimmy's car. You say, Tia, until I done what they have 1.5, but many do the man who until me cast up papa. Now, you know, I will family. A man, maybe be our who can be Chilena or papa, into a man. Into a man, without me, no papa, papa, until me and without me, no bear 3 weeks into the doctor, no, the hospital, doctor, say, our holy night into a man, unto me, near papa, or near to go to your hospital. But some may say, Collebu, how can you be about this guy and surgery? Look up at the Mina and the woman by or no, watch him into the or your papa and run on with your mountain. He feast me, the Amiana. One share to any school fees, me fee, me be into a family. Say, dear, mamma, dear, she knew your battery, 1 year. Mammy and every side, Ghana, maybe a woman of this kind of thing, maybe. Mammy told me, Mammy told
tomatoes but no say yento adie yento into say ni piso ni para de na me each this me family na ya me bisa no mo me kakra so say enye de bia no rent na bisa
me di Dora na obi afre because of nkwala we omo ye twins nti atama me ana obi a de friend na me ton ekutu kakra emfie esi ade mi tumi ton bi mba no na menyi momo no na menim se menyim 7 months na me hu se menyim omunya 6 months e ko 1 year ni mu no na me hu se changes wo nkwala na mu na me hu omu ji nti me di mu kakra na me ni omo ko hospital ye wo mu sa na ba ko ne de nyame bua na kakra na odi nantie na ye nantie papa na we de wantumi ansori anantie bi de sie ne sisi aso mo nya 6 years na last year no ba ko ni yo nantie no di free mi tane ka se nkola no omo yare no mo yare ne cerebral palsy na ba ko ne de no de enye no ye enye dindindin ti se penini die no mu ye de se kitwa ne die no na kitwa ne die ne ye ne kakra dia obetumi anante na penini die ne die ti se nyame be mu na no so ye na exercise ne kakra nti na meni omukọ physio ne kakra sa time na me ton ade kakra nti me awodin ba kakra na me de ne koy sesi ade awodin bi eni ho meni boafo bi aso a obeboa me se me fa akola no enko hospital nje ebe dipo nyame nko a se nyame na ebe mu na nkrofo o atama because of nkola ne yentafo ne nti ewo mu a na obi abase atama me jigwe kakra na fehwe nkola no atama me jigwe kakra na fehwe nkola no we no na physio ne boa no pa nti me be fie no me be ye ne kakra se ska oho na me ne kwanka anka menya no senia ebe yie kakra because in the obe bisa no bia otumi ye peni wuti wahi obe kire o peni wano wahi obe kire o se nipa wo ho dia ye ofere se me ne wodem na me ye dia otumi ye ne nyina asesi a boa na me pese ye mami afi de se me ntumi mfa o mu nko na me ka se sata na mwa no ntumi nko yie nti se bia oyare a se para bia na makoto ama no se we bia wadro bia na makoto ama no afi de nko yie nti me hu se na ne ho aye shikakra nti me kope para be ma no afi de still ade ne koso se na menya sikakra me ne be cause bi ni ho ndi ebe di pra se nyame ambe mu a nko nyame pe na ye ko afo kakra ye nsaka na me ye ni bibredo ye se awo begu echi say me nua we manu na me ye ni nyina instead of wasanka me ne ko hospital na doctor hwe no scanning ni honti me ntumi ane na nko hospital no nti Sunday na akola no edi fi obe fi a obe color fair say yanji o scapra insurance kure wu esese me ko renew ska me de be ko renew bi ni won dia obenya no edi dia obedi kwa na obenya lo fe kwa wo de be fia akoka ne hia sa ko fa kolebuka asa ko no emu ye de ti enu na te fiso ni bi wo ha ye ntumi anka ye betumi akọ na wo ton ni nti wo hwa na wato wadwen mu na wo koso e be bua akwala no be bua no na muaso ni honti esa no wato wadwen na wo ne hyedem ne be hyedem sa ande mu nya kakra ande mu be di no na enu ano no na akwala no so eda wa nkasa wo so ti de mesra ban ni sa ban ni bua ye ti se bro no so no onye bi maye because nipa bebre ewura ha nipa dos wa ha papa enye me nko a o nipa bebre obi mu de omo ade a hihye dem a omo mfo mu mpie obi kwa tu ni de mu watu ni de mu na osori anopa obi wo ho a me hu se na meka no na ya ye bibi kakra ana mwe bia obetumi atena ne ho na wahwe no na oni na osori ana oni ne ko na yakohwe no.
Sandra Sante, a pediatric physiotherapist in one of the leading teaching hospitals in Ghana, called on the government to initiate community centers to support mothers and reduce discrimination among this social group.
My name is Sandra Sante. I'm a physiotherapist, a pediatric physiotherapist. So basically handle kids with issues that need physiotherapy attention, which includes neuro, orthopedics, all conditions that need physiotherapy. And when you have a child with cerebral palsy, it's not even only the child, the mother, the family, because it's a social. Imagine you're pregnant, you have all these wonderful hopes, and then the child comes out and this is it. The trauma, it's both psychological, emotional. A lot of marriages have broken up as a result of that. There's no support. The mother is not able to work. See, so the government needs to come in and financially support these mothers. Make the transport system, there should be accessibility. If she has to move the child to the place where they can get it, they should make it easy for them to be able to do that. So we really need to, and then some of their medications too, you can't get them on NHIS. They need to buy. So the government really needs to come in to give all this support for them, monetary wise. Even if they have to work, there should be that support, because I know elsewhere there are social workers that actually can come home or even physios, they even come home to see the child in the home environment. That makes it easier for the mom, so they don't need to carry them. All these things are things that the government can come in to help with their management.
For Hannah Awaji, a journalist and the executive director of Special Mothers Project, her story is a bit different. She has a supportive husband who helps care for their special needs child. Over the last 6 years, she has been advocating for better policies for mothers with special needs children through her project. For her, special needs require social services and hand handouts.
So I'm Hannah Awaji, the executive director of the Special Mothers Project. Background, I'm a communications person, and I work as a journalist, formerly with the Ghana News Agency before coming to do this Special Mothers as a sidekick. I started a Special Mothers Project because I have a daughter who has cerebral palsy, and I realized that there were no policies covering children with disabilities. So once you give birth to a child with disability, it becomes your lot. You do what you have to do with it. Then it's so frustrating and desperate. It's a desperate situation. So that is advocating for policies, and to also advocate that if there are policies, then it should be implemented. So we should follow through with policies. I have a wonderful husband and 3 children, including my daughter with cerebral palsy. So I wear many hats.
And what do you make of the suggestion that government should establish physio centers in communities so that it helps in terms of the transportation?
I agree. It's actually the best, because then there's a dedicated place where the mom can come and then have that access. It's best, because even with that, apart from even cutting the cost, you can see more of the clients in that vicinity. And once it becomes a community setting, sometimes we help people to understand, because then they realize that these people are part of us. But otherwise, there's this discrimination of always wanting to hide your child. When the health workers go to such centers, it also even serves us an opportunity to advocacy on the condition in that area. So people realize that it's things that can happen. It's part of life, and we need to accept those people for who they are and support the affected families or the families that have had a child with that issue, problem.
Special needs need social support. support services. That is what I think is the biggest challenge. So the mothers talk about we don't work, it's expensive and all those things because they are not able to work. Schools are not accepting their children who are different. And so when you have a child like this, you are saddled with a child. You have to be with a child 24/7. You can't work. If you can't work, how do you earn? How do you live a dignified life? I say that there should be a kind of system that enables me to work. I still work. I work with the Ghanaian News Agency. If today was my regular schedule, by this time I'll be leaving, or I wouldn't even have come here at all. Today I went out. I went on assignment as a journalist. I was assigned to a place. After the program, what I do mostly is to go back home or pick my daughter and file my story from the house. My office understands because I've made them know that, look, I have a child with a challenge and I can't work like everybody else. So what I am talking about every time is that there should be some kind of system, not handouts, not government calling mothers together and giving us 500 cedis and bags of rice and diapers and saying that, okay, we have helped mothers with children. You haven't helped me. If I have a support system and you still decide to give me that, I will accept it. But that is not the main challenge of parenting. The main challenge is that we don't have social services. We don't have support systems in Ghana to support a family like mine. So it makes you sit down idle. You don't work. You will be poor. You will beg. That is not because of the child. It is because there is an error in our policy framework. And our policies that already exist and do not work. If it were working, it wouldn't be like that. So I think that is the biggest challenge we have. If physiotherapy services are close by in communities, we call it community-based, it will be easy to take your child there. But beyond that, I think that mothers need to learn physiotherapy. You need to see a physiotherapist when you are stuck. Maybe your daughter is now sitting and you need the next step. What do I do to get hair curl or something? And you need a physio to teach you that. So you can't be a professional, but you can be a para-professional as a mother to help your child. Those centers are needed. But I even look beyond just having centers that provide physio. I want to look at centers that have rehabilitation. I can leave my daughter there. She will have all the services she needs. I go to work, come back and pick my daughter up and go. First, the private schools, there should be some legislation in Ghana that compels them to take these children. It's not your fault that you have a child with special needs. So if you are coming in as a school, a service provider, there should be legislation that make you bind on you to say that I will accept a child who is differently able, who has special needs. They are extra work, but you need to accept them. That legislation is not there. So private schools don't accept them. Government has an inclusive education policy, but even government schools don't accept them. So you go to a government school, they look at your child, especially the child has cerebral palsy. She's not walking, or she's not talking, we can't accept.
If proper policies and implementation are put in place, mothers with special needs children will get some respite, properly take care of their children, and lead dignified lives.